Welcome to Med Madness. Today we're diving into Bell's palsy. Bell's palsy is a sudden weakness or paralysis of the facial muscles, typically affecting just one side of the face, named after Sir Charles Bell, who first described it. The exact cause of Bell's palsy is unknown, but it's often linked to viral infections like herpes simplex. This leads to inflammation of the facial nerve. Symptoms can include sudden weakness or paralysis on one side of the face, a drooping mouth, inability to close an eye, loss of taste, drooling, and tearing. Diagnosis involves a clinical examination to rule out other conditions such as stroke, with possible tests like MRI or CT scan. Treatment often includes corticosteroids like prednisone, antiviral medication, and physical therapy. The prognosis is generally good. Most people recover fully within 3 and 6 months, though some may have residual weakness. Early treatment is crucial. Living with Bell's palsy involves protecting the eye, performing facial exercises, and seeking support from groups or counselling. In conclusion, Bell's palsy is typically temporary. Early diagnosis and treatment are key, and support and rehabilitation can significantly aid recovery. Thank you for watching. Don't forget to like, subscribe, and share this video to support our channel, Med Madness.